If you're watching this video, it may be for someone you love, a parent, a grandparent, a spouse, someone who has been told by a doctor, possibly more than one doctor, that they need a knee replacement. Or you may be watching this for yourself. You are the patient. You are the one in pain and you have been told the knee is gone. உங்களுக்காக பார்க்குறீங்களா இல்லை உங்கள் அம்மா அப்பா இல்லை அப்பாக்காக பார்க்குறீங்களா? இந்த வீடியோ ரெண்டு பேருக்கும் தான். Either way, something does not feel right. You are looking for someone to either confirm the decision or give you a reason to slow down. I am going to give you that reason. I am Dr. A.K. Venkatachalam, founder of the Madras Joint Rejuvenation Center in Chennai, fellow of the Royal College of Surgeons, UK trained 4 decades in orthopaedics. I spent much of my career performing knee replacements. I have seen from the inside what replacement does for patients who truly need it and what it does to patients who did not. I now practice exclusively joint preservation and biological treatment. I have no financial interest in recommending surgery and every reason to tell you honestly when it is and when it is not needed. சில நாட்கள் முன்னாடி நான் ஒரு ஷார்ட்ஸ் வீடியோ போட்டிருந்தேன். அதை பார்த்து இங்கே வந்திருக்கீங்க, நன்றி. The first thing to do, slow down. The first thing I want to tell you is also the simplest. Slow down. In the vast majority of cases, it is not an emergency. I understand the pressure. The pain is real and the hospital has offered a date. But there are 2 factors that accelerate this decision which are rarely spoken about honestly. 1. The insurance factor. When a procedure is covered by insurance, the perceived cost drops to 0. The natural break of financial responsibility disappears. Ask yourselves, would it feel equally urgent if you are paying for it entirely from your own pocket? If the answer is no, slow down. 2. The robotic replacement factor. Glitter versus plain metal implant. There is a particular glitter to this technology. But let me be precise. The robo guides the cuts. It does not change the implant. It uses the same materials and has the same risks. A perfectly aligned implant in a patient who did not need replacement is still an unnecessary procedure. வலி என்பது சர்ஜரியை சீக்கிரமாக பண்ணுறதுக்கான காரணம் இல்லை, கரெக்டான டிசீஸை கண்டுபிடிக்கிற காரணம். தி அசஸ்மெண்ட் கேப். Every week I see the same pattern of missing investigations. Patients come to me with the ultrasound scan. Ultrasound is useful for soft tissue, but it cannot grade arthritis or show bone marrow lesions. If you only had an ultrasound, the assessment is incomplete. MRI before plain X-rays. This is the wrong sequence. X-rays gives the context the radiologist needs to interpret the MRI. The missing merchant skyline view. இது முழங்காலோட front side காட்டுற ஒரு special X-ray. Without it, we miss patellofemoral arthritis and patellofemoral instability, a completely different condition with a different treatment. Referred pain. There is one more cause. Referred pain. வேற இடத்திலிருந்து வர வலி. The nerve supply to the knee, hip, lower back share common pathways. If the knee investigations are normal but the pain is high, check the hip and the knee or ask your doctor to check the hip and the knee and the spine. What should happen before any decision? These are the minimum investigations needed before consenting to surgery. Plain X-rays, AP, lateral, merchant skyline view. 3 Tesla MRI. This is the standard. 1.5 Tesla misses early changes. Metabolic panel. The 4 PRASAD markers. Clinical examination. Hip and spine check. இந்த லிஸ்ட்டை ஸ்க்ரீன்ஷாட் எடுத்து டாக்டர் கிட்ட போகும்போது இதை கேளுங்க. The metabolic assessment. The heart of PRASAD. Traffic light triage. Green, amber, red. This is what separates PRASAD from every other treatment. We assess 4 markers to see if your biology can support rejuvenation. Number 1, HbA1c. High sugar stiffens cartilage fibers. The joint does not wait for the number. The biological benefit of control begins within days. The HbA1c catches up later. 2. Triglycerides. These tell me about the quality of the cells we harvest. High levels means the seeds, MSCs from your fat will underperform. Vitamin D. Vitamin D போனுக்கு மட்டும் இல்லை, போனுக்கு மட்டும் கிடையாது. இது ஒரு cartilage hormone. Without it, the matrix PRASAD is trying to support cannot be built. 4. HSCRP. This tells me how strong the systemic headwind of inflammation is that the treatment must overcome. What preparation looks like. If you are in the amber or red zone, it is a roadmap. We optimize for 4 to 8 weeks using curcumin to target HSCRP, protein admixture with every meal to blunt glucose spikes. 36-hour fasting. மேல் பார்வையிலான உபவாசம், supervised fasting. இதுதான் triglycerides reset பண்ண பெஸ்ட் வழி. What happens at MJRC? At MJRC, we set aside whatever has been done before and begin again. I examine your gait, how you sit cross-legged, and how you perform namaz. Only when the complete picture is in front of me do I give an opinion. சென்னையில் இருக்கிறவங்க நேரில் வரலாம், வெளியூரில் இருக்கிறவங்க ஆன்லைன் கன்சல்டேஷன் பண்ணலாம். If you or your parent has been told they need a knee replacement, do not panic. Do not rush. Use the checklist. Know your zone. If you would like that assessment done at MJRC, the link is in the description. Subscribe and leave a comment. Which of the 4 metabolic marker has not been checked for you yet? I read every comment.